In this video, we are discussing the 5 determinants of health in Canada. We want to understand how those determinants impact the health of Canadians from all walks of life. So let's take a closer look at these very important factors that determine the health of Canadians. Now, the first one is the type of employment. Now, this is a very important point because the type of employment often determines your exposure to diseases, determines your ability to seek healthcare, determines your socioeconomic status. And socioeconomic status, of course, we're going to be discussing that. So type of employment is very important because Canadians in precarious employment are often exposed to all kinds of diseases. Now, we saw this very evident during the pandemic where racialized Canadians, especially women, in long-term care homes and PSW, personal support worker area, were very exposed. They were very exposed to the virus because they were frontline workers. They were interacting with senior citizens. They were interacting with those that came to visit the senior citizens. They were interacting with the general public, essentially. And some of them went into homes to take care of senior citizens. Those citizens may have been exposed to the virus. So there was a very high percentage amongst the frontline workers, those in long-term care, those in precarious work, those in PSW, again, personal support worker type jobs, were more exposed to the virus. But additionally, those that don't have permanent jobs with no benefits were exposed as well. Part of contracting the virus was depending on how your health was prior to contracting the virus, right? Were you taking care of yourself? Were you eating healthy? Were you engaged in preventive medicine? All of these factors were very important in terms of one's ability to stave off the virus, or even if you're infected by the virus, the ability to overcome it with the immune system. These were very important factors, that will explain how Canadians, with precarious employment were more susceptible to the virus. So precarious employment is a very important determinant of health because, once again, depending on your exposure to the public, depending on the type of work you did, depending on the neighborhoods you visit and frequency of travels and etc., will determine your health essentially. So type of employment then is a key determinant of health. Now, place of residence is also a determinant of health. And some people live in communities where, again, you have people, especially racialized people, that are not that have precarious employment, that have low socioeconomic status, and you mingle with those people. Sometimes they are exposed to the virus or exposed to the different types of diseases, and that impacts the health as well. Right, and also the type of living arrangements that people have also determines their health. If you're a multi-generational family living in one home, that is very significant in terms of health. Older folks are more susceptible to diseases because their immune system perhaps is not holding up as much. They are not as active as they should have been, and many other factors come into it. So place of residence is very important. A lot of racialized Canadians live in multi-generational homes, and that means oftentimes they don't have enough rest, they don't have perhaps enough to eat, and they don't have the resources for the extra activities that will keep them healthy, even little things as buying vitamins, supplements, etc. Sometimes it's a challenge. And then you go into a home where you have many people living, and that impacts your ability to really concentrate, and that may take up your stress level. All of these things impact health. And the place of residence impact health as well. And some people living in government-assisted housing may also have their own challenges as well. And those challenges may lead to high stress. That will impact your health. Education also impacts health. Education is a very important factor in life because education is the vehicle to social mobility in a lot of societies. And the more educated you are, most likely you have the capacity to lead a healthy life because you're exposed, you have knowledge, you have information, you have access to information, you're able to take care of yourself, you're able to get information that is very helpful in terms of preventive health. And that is very important as well. And also you have the capacity, financial capacity to afford good medicine and good health care. Education is very important because those that are not educated may not have the resources, may not have the information, most importantly, may not have the information and may not have the mindset to take care of themselves and their families. Most likely they're working in, factory jobs that perhaps don't pay a lot of money, and they are living from paycheck to paycheck. And in those circumstances, it's very difficult to think beyond one day and think about preventive health and think about activities that contribute to good health. It's very difficult to think along those lines when you're living paycheck to paycheck, when you are not, you don't have the capacity, when you don't have the information, you're just living for that day. Education becomes a critical point here that impacts the health of Canadians, the level of education that is, that impacts the health of Canadians. Now, socioeconomic status is also very, very critical. And why is that? Because socioeconomic status determines your economic position in society and determines your financial ability, right? Your financial ability to afford good health care, to be able to afford dental care, to be able to afford other types of care that are not covered by the universal health care system. And those in the lower economic status, again, don't have the resources, don't have the means and the ability to really take care of themselves and their families. Again, because they are worried about putting food on the table. They're worried about the rent. They're worried about car payments, and don't have the ability to think beyond that because they are being hampered by their social economic status. And those in lower socioeconomic status, they are more susceptible to diseases because again, they are not taking the preventive health care that is very needed, because some of them are really busy working, several hours a day, and they come home and they are stressed, and the stress level is high, and that impacts, their health. Socioeconomic studies have become a very key point in terms of how people view health, in terms of how people assess healthcare, in terms of how people really see the need for healthcare. And the final point here is race. Race is a very important factor here as well because, racialized Canadians, for example, have difficulties, in many areas in life, includes health. And oftentimes, most of them fall in these four categories in terms of lower socioeconomic status, perhaps lower education, place of residence, living in communal residence environments, and multi-generational environments, and type of employment. Some of them have precarious employment that does not encourage really, healthy living because once again, they are stressed. Some of them have two jobs. Some of them have more than two jobs, and they are stressed, and they don't have time to rest. They don't have time for recreation. They don't have time to travel. They don't have time to take off and think and reflect because they have to work and put food on the table and take care of their families. And so racialized Canadians are most likely impacted by these factors because of the disadvantages they have in society. Because of the systemic and institutionalized racism and disadvantages that they have in society, they are less likely to seek, preventive health care and be healthy. And we saw this during the pandemic, where racialized Canadians were most impacted by the virus, by the infection, because of their exposure to the disease. and also because of the fact that most of them don't have the resources and access to good healthcare. So when we talk about the 5 social determinants of health in Canada, we are talking about these factors. There are certainly more factors that can be discussed, but these are 5 main factors that impact the health of Canadians. Type of employment, precarious employment breeds stress, breeds uncertainty, and people are constantly worried about where if they will have a job tomorrow, and the jobs that they have are risky and exposes them to all kinds of dangers. Place of residence, Canadians that live in multi-generational homes, exposing the older residents in those homes to diseases, and that does not help with the health. Certainly not. The level of education, the more exposed you are, the more likely you are to take preventive medicine and have the capacity to afford good medical care. So, and social economic studies also another point here that we've just discussed. Your level, the ability to afford good medicine, the ability to again engage in preventive medicine and be able to afford good medicine for yourself and your family. And race, of course, as we just discussed, has a tremendous impact because racialized Canadians are the most impacted because of systemic racism, institutionalized racism, and all of these factors we just discussed.